Dr. Angela Scott, Director of the National Blood Transfusion Service and feature artist of our video, will now do the introduction of our keynote speaker. I can take that liberty. Welcome, Dr. Scott.
Thank you, Madam Chairperson. Dr. Carissa Etienne, Mr. Joseph Gregoire, Honorable Dr. Fenton Ferguson, Minister of Health, other ministers of government, our own permanent secretary in the Ministry of Health, Dr. Jean Dixon, members of the Diplomatic Corps, Chief of Defense Staff, Dr. Goulburn, representing the Commissioner of Police, Custis Marigold Harding, Ms. Margarita Schultz, PAHO WHO representative in Jamaica, heads of international organizations, members of the Consular Corps, chairmen of boards of regional health authorities, heads of departments and agencies, members of the health sector in Jamaica and the Americas, distinguished ladies and gentlemen, and my very special guests, the boys and girls in the audience with us, good morning. It is with great delight that I introduce to you this morning Dr. Carissa Etienne. Dr. Etienne has had a long and distinguished career in the field of medicine, with particular interest in primary health care. She received her Bachelor's of Medicine and Bachelor of Surgery from the University of the West Indies, Mona, here in Jamaica, and subsequently went on to do a Master's in Science in Community Health in the Developing Countries from the London School of Hygiene and Tropical Medicine, University of London. Dr. Etienne began her medical career in Dominica, where she grew up, starting as a medical officer of the Princess Margaret Hospital, where she eventually became the chief medical officer. She served her country in a number of key positions for over 20 years before branching out into the wider health arena. In July 2003, she became the Assistant Director of the Pan American Health Organization and led 5 technical areas, including family and community health. In March 2008, she joined the World Health Organization in Geneva, Switzerland, as Assistant Director for Health Services and Systems. Perhaps, though, Dr. Etienne is best known for her work in health systems financing, the path to universal coverage. This resulted in the 2010 World Health Report that is recognized worldwide. Dr. Etienne has also led the World Health Organization's global agenda to support universal access to safe and efficacious medicinal products and the development of a global code of practice for the international recruitment of health personnel. In September 2012, Dr. Etienne was elected as Director of the Pan American Health Organization and subsequently began her 5-year term in February of this year. In your inaugural address, Dr. Etienne, on January 31, and some of us were privileged to attend virtually, I was impacted by your closing remarks, remembrance from my childhood. You related a story from your early childhood when a neighbor who had 4 children was going off to give birth to her 5th child. Your great aunt wished her safe passage. You are confused but your mother explained that sometimes when women give birth to children, they do not return home. You were saddened and concerned that this mother might not return home to her other children. You indicated then that the example from your childhood motivates you even today as you seek universal health for all. It struck me, if we could only motivate some of the children here today, the issue of universal coverage and access to safe medicinal products, including blood and blood components, would not be so daunting after all. I will not hold the audience in suspense any longer. Please join me in welcoming to the podium Dr. Carissa F. Etienne, Director of the Pan American Health Organization.
Thank you, Angela, for this generous introduction. Honorable Minister of Health, Dr. Fenton Ferguson, other cabinet ministers, members of the diplomatic corps, representatives of UN organizations and international organizations, Dr. Dixon, Permanent Secretary of the Ministry of Health, other permanent secretaries who are with us today, officials of the Ministry of Health and the government of Jamaica, mayors, distinguished guests, young people, boys and girls, ladies, gentlemen, the media, friends, greetings. I want also to greet those who are with us on stream. Muy buenos días a mis amigos colegas de América Latina. Bienvenido. Estoy muy feliz que estamos conjuntos en este evento. Greetings. Today, we join the rest of the world in observing Blood Donor Day, a day when we acknowledge and thank all those who give so generously the gift of life by donating blood, voluntarily and unpaid. On Blood Donor Day, we raise awareness of the need for safe blood and blood products, and we appeal to persons, especially the youth, to become regular unpaid donors. Indeed, I am delighted to be here this morning to join this country in the celebration of World Blood Donor Day. This is my first visit to Jamaica since taking up office as director of the Pan American Health Organization. I promise you it won't be the last. And indeed, Mr. Minister, it does feel like a homecoming of sorts, as I spent what I always refer to as my most enjoyable part of my life as a teenager in Jamaica on the Mona campus of the University of the West Indies. I could dance every dance that there was in Jamaica. I want to thank the government of Jamaica and indeed the Ministry of Health for such a warm welcome that has been afforded me, and certainly for the opportunity to participate in this event. World Blood Donor Day was established by the World Health Assembly in 2004. And on the 10th anniversary of World Blood Donor Day, we are rallying around the theme, Give the Gift of Life, Donate Blood. Jamaica, as you've heard, has been given the honor of hosting the official launch of this day, 2013, for the region of the Americas. The global host country this year is France. The main objectives of the World Blood Donor Day are to thank donors, who save lives through their donation, to promote voluntary unpaid blood donation, and to convince ministers of health worldwide to make a commitment to achieving self-sufficiency in safe blood and blood products through 100% voluntary, non-remunerated blood donations. But you just heard, and I must tell you and confirm, that your own minister, Honorable Fenton Ferguson, he doesn't need any convincing. He has already demonstrated his full commitment for the availability of adequate and safe blood and blood products. And I think you should give him a round of applause. Ladies and gentlemen, transfusions of blood and blood products help save millions of lives worldwide each year and help improve the health of the people who need them. Among some of those people are women with complications of pregnancy and complications of childbirth, accident victims, persons suffering from sickle cell anemia, persons suffering from blood disorders, other blood disorders, and cancers. I'm sure that you realize that we continue to see the death of mothers because of childbirth. And every time, thank you, Angela, for reminding me of this story, it almost always brings tears to my eyes, because we lived in a world where giving birth was such a risk. But the truth is that we continue to live in such a world. Every year, 350,000 women die because of childbirth. Right here in the Caribbean, we have the country of Haiti, where women continue to die needlessly. And I am sure it is the same in Jamaica as well, that we do see deaths because of childbirth. And one of the most common reasons for these preventable deaths is blood loss, And we just need to remember this on this day. Dr. Dukas got us to read the messages at the back of our programs. I am sure that you did not know before you came here that for every blood donation, that at least 3 lives could be saved. And I think what a tremendous opportunity to express solidarity, charity, and love of neighbor. Individuals who donate their blood provide a unique contribution to the health and survival of others. Never let us forget that blood is the most valuable gift that one can offer each other. Every blood donation is a gift of life. And I wish to take this opportunity to thank each and all of you who continue to donate blood regularly and are not paid for it. You, I agree, Mr. Minister, they are our heroes today. The need for safe and secure supplies of blood and blood products is universal. All countries, rich and poor alike, require blood in sufficient quantities to meet their needs. But the goal is that all countries will become self-sufficient. Rich countries must not buy blood from developing countries. It happens, not necessarily in our region, but we must make the point. This also means, however, that every effort must be made to ensure the efficient and appropriate use of blood and to avoid wastage. Every unit of blood that we throw away is 3 lives that we could have saved. Developing countries will have to build the capacity to collect, store, and to extract the various products and components from blood. The ability to fractionate out the components from whole blood maximizes the use of every donated unit. But blood transfusion services, they face a dual challenge. A challenge of assuring not only a sufficient supply, but also the quality and safety of blood and blood products for patients whose lives or well-being depend on those transfusions. Blood supplies, therefore, need to be constantly replenished since whole blood and blood components have a limited shelf life, a sell-by date, as they would call it. Every country faces an ongoing challenge to collect sufficient blood from safe donors to meet national requirements. As you've heard, Jamaica meets just over 50% of its requirements for needed blood, with an actual level of blood of 30,000 units being collected. As a result, the country is actively trying to increase blood donations. And I want to recognize all of those volunteers and all of those officials who strive every day to ensure that blood is available. Without a system based on voluntary unpaid blood donation, particularly regular voluntary donation, no country can provide sufficient blood for all patients who require transfusion. Regular voluntary blood donors are the safest source of blood, as the risk of blood-borne infection among these donors is lower than among people who donate for family members or who give blood for payment. The goal, as you've heard, the goal to which countries of Latin America and the Caribbean, the goal that they committed to is to obtain 100% of their blood from voluntary unpaid donors. To date, as of 2011, the countries in the Caribbean achieve 56% of their blood from voluntary unpaid donors, and in Latin America it is 41%. In Jamaica, you are at 15%. So there's a way to go, and it is your responsibility collectively to ensure that you can raise this so you can reach by 2020 the 100% target. So unfortunately, we have not yet been successful. If we are to reach that target, all of us must intensify efforts to improve the education, promotion, capture, and selection of donors. Countries need to increase blood collection urgently, and in particular, to increase voluntary contributions. I don't make any apologies for repeating this often, because if you remember anything from today, you need to remember this. In this regard, the recruitment of young blood donors is key to the growth of the pool of voluntary blood donors. I am told that youth aged 17 who are in high school, as well as those attending tertiary institutions and youth camps all across Jamaica, are making their contribution to these life-saving efforts. And I am told that the number of units that are collected in this way, they contribute almost 50% of the blood that is donated in Jamaica. So I want us today to big up the young people. But in the same breath, I want to appeal to all eligible individuals to make a long-term commitment to donate blood regularly. And some of you may be asking, well, how do I know that I'm eligible? Go to a collection center, you will be screened, and we will tell you whether you are eligible or not. But I believe, and deep down, I believe that an adequate, safe supply of blood is a responsibility of the community, collectively and individually. It is a shared responsibility. Government's commitment is fundamental for an effective blood supply program, and governments everywhere must recognize that access to safe blood transfusion is an integral component of quality health care. People everywhere, irrespective to their race, irrespective to their status, and to their ability to pay or not, have a fundamental right to receive blood or blood products when they need it. Equity to access is essential, and governments have a responsibility to guarantee that right and to ensure equity. A national blood policy based on 100% voluntary blood donation that is supported by a legislative and ethical framework is an expression of government's commitment to the availability and safety of blood and blood products for all patients requiring transfusion. But collaboration and partnerships are important driving forces for blood transfusions and blood donations. A blood donor program cannot operate in isolation and requires active collaboration with partner organizations. In this respect, we must acknowledge the role that the Red Cross Society and Red Cross Crescent Society has played throughout the years. Stakeholders must contribute to meeting the nation's need for blood and blood products at all times. Partnerships must be built in every sector, all of government, the private sector, civil society, and at every level, from the community to the national and the international level. Volunteers also play and can play a variety of roles in the blood donor program. Opportunities for collaboration beyond the traditional community-based partners can be opened up by broadening the public perception of voluntary blood donors as active, valued members of society, in addition to being contributors to healthcare. I want to congratulate Jamaica on its vibrant partnerships and the role that these partners have played in the development of the National Blood Transfusion Service in Jamaica. Voluntary organizations in Jamaica have played an important role in the transfusion service, from the original Red Cross Committee under the chairmanship of Mrs. Isabel Magnus. Mrs. Magnus, I salute you. Over the years, voluntary committees have been active in each parish, assisting in promotion, education, and even fundraising. I am told that today, the most active voluntary group at present is the Blood Bank Association. People everywhere, people in Jamaica, in all of the Caribbean, in all of Latin America and North America, must become aware of the need for blood and blood products as an essential component of healthcare. And they must understand that this blood cannot be obtained by any other means except through the donation of human blood. This must be accompanied by recognition of the special role that the donors play in saving lives and improving health. 2013 represents the 65th anniversary of Jamaica's National Blood Transfusion. I wish to commend the people and government of Jamaica for the many achievements that you've made over time for your national blood transfusion service. And you heard the minister list many of those achievements which the country has made. PAHO has worked alongside the government of Jamaica, the Ministry of Health, and its partners in ensuring the development of the transfusion service in Jamaica. As well, PAHO has recognized Jamaica's expertise and commitment and has invited Jamaica's participation in PAHO's expert committee for the development of a new regional plan for blood safety for 2014 to 2018, as well as an invitation and a full participation on PAHO's technical working group to revise the Caribbean regional standards for blood banks and transfusion services. As the director of PAHO and in the name of PAHO, I want to reiterate PAHO's commitment to work with the people of Jamaica as with the people of all of the countries of Latin America and the Caribbean and North America. in the whole spirit of equity, in the whole spirit of ensuring that people's human rights are met, and to ensure universal health coverage. Finally, permit me to remind each of us that we all are responsible for ensuring a safe, adequate, and reliable supply of blood. Each of us can and must do our part, and you can begin by giving the gift of life. Please donate blood. It is now my distinct honor to officially launch World Blood Donor Day here in Jamaica for the region of the Americas. Thank you.